How can I relieve right side pain during pregnancy?
Hello, and welcome to this informative video on how to manage right side pain during pregnancy. If you're pregnant and experiencing this discomfort, you're not alone. Many expectant mothers go through similar experiences. But don't worry, we're here to help. In this video, we'll explore some effective strategies for alleviating right side pain during pregnancy. Remember, these methods are safe and often recommended by healthcare professionals.
Why am I experiencing right side pain during pregnancy?
Before we jump into solutions, it's important to understand why this pain occurs. It could be due to various reasons, such as round ligament pain, which is common as your uterus grows and stretches the ligament. It could also be due to gastrointestinal issues, such as gas and constipation, which are common during pregnancy. While these causes are often harmless, severe and persistent pain can indicate more serious issues like preeclampsia or gallstones, which require immediate medical attention.
What are some safe ways to relieve right side pain during pregnancy?
1. Prenatal yoga and stretching. Prenatal yoga and stretching exercises can be very beneficial. They help to stretch out the muscles, alleviate tension, and enhance overall comfort. Remember, it's always best to consult a professional or a prenatal yoga instructor for suitable exercises. 2. Heat therapy. Applying a warm compress or using a heating pad on the painful area can often provide relief. Make sure the heat is mild and comfortable, not too hot. 3. Hydrate and eat a healthy diet. Staying hydrated and maintaining a healthy diet can relieve gastrointestinal issues. Drinking enough water and consuming foods rich in fiber can help reduce constipation, bloating, and related discomfort. 4. Appropriate rest and position. Taking frequent breaks and lying on your left side can often alleviate right side pain. This position helps to take the pressure off the inferior vena cava, the main vein on your right side, and improve blood flow.
When should I contact my healthcare provider?
Despite these techniques, if your pain is severe, persistent, or accompanied by other concerning symptoms such as fever, vomiting, or bleeding, contact your healthcare provider immediately. It's crucial not to ignore persistent pain as it could indicate more serious conditions. We hope this guide on managing right side pain during pregnancy has been helpful. Pregnancy is a beautiful journey, but it can come with its challenges. By understanding what's causing your discomfort and knowing how to safely manage it, you can navigate this journey more comfortably. Remember, you're not alone, and there are many resources and people out there ready to help. Stay strong, and take care.